been certainly a lot of attention paid to the town hall meetings and the controversy surrounding them and the channels for public response. Does the foundation have any forum for interacting with the public?
We do. We are increasing our activity through surveys with AP, by having a blog, increasing the activity that our staff has through Twitter and other social media, because it is important that the public understand to an even greater extent the issues related to health and healthcare. One of the things we learned in this last month of heated debates is that almost everyone cares passionately about healthcare. But we also have learned that they are often misinformed about some of the very basic policy and personal health issues. And so we see it as part of our responsibility as a foundation to debunk some of those myths and to raise the overall understanding about these important issues.
Mm-hmm. Very good. You are a physician, an expert on aging. A lot of Americans don't recognize the extent of long-term health needs for Americans' seniors, nor do they recognize how many older Americans are living in poverty. Mm. Are these problems at all linked, and what steps should we be taking to address them?
Well, the good news is that we are living longer, and but what that challenges us to have to deal with is that all too often as we live longer, we have a higher probability of having some disability. And most people, even though they don't want to acknowledge it, are going to spend some part of their life living with a disability and needing help with the basics of daily living. So one of the things that the foundation is trying to do is increase the kind of options that people have as they face that challenge in life, whether it's more community-based options, and we have programs to try to improve the systems of care and coordinated care in communities so that when you or I are at the point where we need to have help in our own homes, there are those services available in communities. But then we also are trying to recognize and deal with the fact that not everyone is going to be able to age in their own home. People are probably going to need to be in some kind of an institution. That's just the reality of our demographics. And yet they're going to want more choices, and they're going to want different choices. So one of the things we're trying to do is help develop to its fullest extent a new kind of nursing home. It's called a greenhouse, and it's not your grandmother's nursing home. It's not 120 beds of institutional looking kinds of care. It is a home with 7 to 12 bedrooms and a few caregivers who do all of the care, and in the course of it develop a strong bond with the people living in that home. And it's demonstrated much better outcomes in the sense that families are happier, the people living there are happier, the staff don't turn over, they stay and provide the care, which ultimately leads to better care and cheaper care. So we have been very excited that there are now 50 of these around the country, and we look forward to the day when there's one in every community. That's my goal, is to have one in the community I'm going to be living in when I need one.
As a doctor, what role do you think doctors can play in making communities healthier?
Doctors obviously play a critical role in that one-on-one communication with patients where they can address the issues that are facing the community. But I think doctors also have an obligation to get out of the examining room in the hospital and take on that role of trusted spokesperson about what really is going to help the entire community get healthier and stay healthier. So in a lot of ways we have to get back to our basic roots when Hippocrates said that we have our greatest commitment to improving the health of the entire population. So doctors have to do both, the individual and the population-based health of the patient.
For many Americans, healthcare is a doctor, a local hospital, and their insurance company. What's the role of foundations in promoting healthcare?
Well, foundations have a role in defining some problems that are important problems that others can't or won't take on, and then looking for new solutions to address those in an innovative way, and getting the word out, bringing new partners together, getting them to talk about it and describe for policymakers what those new innovations are. So at the same time that we are interested in the day-to-day of, as you say, the doctor, the insurance company, and the clinic that people go to, we also as foundations have to look at what are those big problems that no one is addressing yet and try to find solutions for those and then get the word out.
The number of uninsured Americans has been a huge issue in this current debate. Less discussed, however, is the number of uninsured children. Robert Wood Johnson Foundation's own research says that recent legislation to expand insurance for children has not entirely closed the gap. What is missing, and how do we reach every child?
Well, we know that CHIP has been a huge success, along with Medicaid, in doing a big job in closing that gap. There are now kids who have insurance that 10 years ago would not have had insurance. And we also know that one of the things that is critical in ensuring that these kids actually get enrolled is how simple it is for their parents to know that they're eligible and to get them enrolled. So making these programs and the enrollment simpler and simpler is a critical part of what needs to happen going forward. The other thing that we know is that families' situations change. Nothing has taught us that more poignantly than the recession of these last few months. And people who didn't know that they were eligible may be eligible and just don't know it. So we've got to do a much better job as a nation in not only making it simpler, but continuing to tell people this is available and you may be eligible for it, because often in the throes of all the other things that are going on in their lives, they just haven't gotten that message. So I think if we can consistently do those two things, our research has showed that we can continue to close that gap, and it's absolutely essential that we close the gap, because when kids don't have health insurance, we know that they don't get the care they need, they don't have access to the kinds of things that their parents would want them to do, like being engaged in sports and things like that. So it's absolutely critical that we work on simplifying and closing this gap.
Are you optimistic or pessimistic about healthcare reform?
Well, I'm a pragmatist, and I believe that one of the things we see every place we go is that this is an area that people care deeply about. And they know that our system is not working well. They know that they're at risk for losing their insurance, and they are saying in a very clear way, the system has got to be fixed. So with that pragmatic view, I think that our policymakers are going to listen and move us towards a reformed health system. So whether you call me a pragmatist or an optimist, I think we're going to get there.
Okay. Thank you very much for joining us.
It's my pleasure.